Hello everyone, I'm Dr. Sakamoto. In this channel, we provide content on regenerative medicine and other medical topics, so please subscribe. Today, I would like to introduce a case of regenerative medicine for the after effects of cervical disc herniation surgery in a man in his 70s. This patient had numbness in both legs and hands for a while and experienced difficulty walking. The numbness in the hands and legs was challenging to determine whether it was due to an underlying condition or cervical disc herniation. However, because of difficulties in walking, it was decided to operate surgery for cervical disc herniation. Despite the surgery, the difficulty in walking persisted, and the numbness in the hands and legs could not be relieved as expected, leading the patient to visit our clinic. When examined at our clinic, it was found that the strength of the iliopsoas muscle, which is crucial for walking, had decreased by about 20%. Additionally, the strength of the right biceps bronchi muscle had also decreased by approximately 20%. Here's an MRI image of the patient. In this image, the white area around the 5th and 6th cervical vertebrae likely indicates the location where the spinal cord nerves have been damaged. In response to these symptoms, the patient received 2 administrations of cultivated stem cells directly into the spinal cord without freezing. After the first administration, within a few days, the numbness in the hands reduced to only the thumb, the strong numbness in the right leg halved, and the muscle strength of the iliopsoas and biceps bronchi recovered significantly. 1 month after the first administration, the second spinal cord injection was performed. Following the second administration, the patient, who had experienced numbness in both hands and feet, was delighted to find that it had completely disappeared. Additionally, the difficulty moving the legs while walking also disappeared. I have done the surgery for herniated discs in the neck and lower back in the past. After the surgery, numbness and weakened muscle strength did not recover, and there were no effective solutions for such issues. Nevertheless, we have observed many cases where symptoms completely disappeared or weakened significantly by delivering stem cells directly into the spinal cord. While the improvement of symptoms varies from person to person, witnessing the disappearance of persisting symptoms and the regaining of capabilities that were previously impossible brings me great joy. Seeing numbness and muscle strength that didn't recover despite surgery return through stem cell injections into the spinal cord emphasizes the numerous possibilities of stem cell treatments. Today, I introduced a case where stem cells were administered into the spinal cord for postoperative sequelae of cervical disc herniation. Thank you very much.